Hi there, my name's Emily. In this video we're going to look at the different types of choking episodes a person can have. And specifically in this video we're going to look at how to treat an adult that's choking. I've also made videos about how to treat a baby and also a child, and I'll leave those links in the description below for you. Now there's two types of obstructions somebody might have. There is partial blockages and full blockages. Now with a partial airway obstruction, blockage, this could be something like a fishbone. It's caught it in the throat, it's causing them severe pain, discomfort, the person's coughing a lot, they're getting very distressed, very tired, and the face is very red. So with this person, we're going to go up to them, as we do with anyone else who's choking, and we ask them the most obvious question, are you choking? If they can say yes they are, they're not really choking, in a sense of a complete airway obstruction. So this person has a partial airway obstruction. We need to allow them to cough. We need to try and calm them as much as we can, and hopefully they'll clear the obstruction themselves. But the most important thing to remember is that person is breathing. There's nothing else blocking their throat. However, if they went to eat something else, then that could become a complete airway obstruction. A complete airway obstruction might be someone eating a bit of steak that's got stuck, a grape that's not been cut up. And when it's got completely stuck in their throat, they won't be able to talk to us. So when someone's got a complete airway obstruction, that's where we need to go through the manoeuvres we're going to talk about now. These manoeuvres are back slaps and abdominal thrusts. When someone's got something stuck in their throat, they can't actually get air past it. So they're going to do what's called the universal sign of choking. They'll take their hands to their throat and they'll gasp. They can't make any noise. They're going to look very panicked, very wide-eyed. They can look very scared. Sometimes they'll start to look blue as the oxygen levels start to drop, or the face will go pale depending on what skin colour they have. Sometimes what they'll also do, they'll be embarrassed. What could happen then is the person may leave the room. They may be going to the toilets or they'll go outside. So if you see someone who's choking has suddenly left the room, please follow them, because they need some help, because once they get to a point when they collapse, they will need CPR. And if they go by themselves, they will collapse and they will die. So as soon as you see a person is panicking, they're holding their throat, they're turning blue, say to them, are you choking? We need to allow them to cough. We hit them up to 5 times between the shoulder blades with the heel of one hand. We make sure we check to see if the blockage has come out, so we don't just hit them randomly 5 times. We hit, we check, we hit, we can check. Now the idea of these back slaps is hopefully to dislodge the item so they can expel the air out of the lungs and the item will hopefully come out. However, when you're doing the back slaps, always look forward to see whether something actually is coming through. If that still doesn't work, what we need to do is called an abdominal thrust. So we're aiming for the bit just underneath your rib cage, but above your stomach muscles. Front here, so underneath the rib cage, above the stomach muscle, other hand at the top. And what I will do is an inward and an upward motion. Okay, this is called an abdominal thrust. And I'll do up to 5 of these. If that still doesn't work, that's my second one. Checking the mouth each time. Obviously I'm not doing this for real because this person isn't choking. And if I do this for real, it actually causes some internal damage. Up to 5 of those. If after 5 abdominal thrusts it doesn't work, I'm then going to call 999 or 112. And then we're going to continue alternating between 5 back slaps with 5 abdominal thrusts. Now, if you've enjoyed this video, please hit subscribe. I'm here to give you lots of useful tips about first aid. I love teaching first aid. I've also produced lots of e-learning courses for you as adults, but also I've got lots of free children's first aid courses where I teach them important life-saving skills. And I'll leave a link in the description below for you so you have access to them.